Karlfedlt.
Good morning. How are you doing today?
I'm doing well. How are you?
I'm doing good. Great. Thanks for hanging with me this morning.
Absolutely. And it's early morning for you, right? 8 a.m.
Well, it's 8 o'clock. It's not too bad.
Okay. What's your general routine in the morning? Do you do podcasts earlier or later in the day?
Yeah. So usually it's podcasts like early, late. When I don't see patients.
Yeah, makes sense. I try to get most of my conversations done before 11 a.m. because I find that beyond then it's just challenging to maintain focus, but certainly I accommodate where I can. But for the most part, I'm an early morning person.
Are you okay? Good.
I
Yeah.
am.
I try to do everything around seeing patients. Yeah. So that's my. Yeah, usually I see patients between 9 and 5 or something like 9 and 6 or something like that. So
I'm sure. Well,
yeah,
first of all, I'm so excited to connect with you. I've heard your name many a time. I'm a big fan of your work. And a little bit about me. Hopefully, you've had a chance to check out my platform, but I started Well and Strong about 3 years ago now. And it really started because my mom was diagnosed with stage 4 breast cancer back in 2018. And it essentially just became a platform for me to share the research I was doing for her grew. I started working with more integrative doctors, contributing content, and then felt called to start this podcast. So I started this podcast, Dr. Karlfeldt, last May. So it'll be coming up on a year. I have about 36 episodes. I've really been enjoying it. It's been so fun to meet, again, people I admire in the space like yourself. So truly honored to have you here, and I'm excited for our conversation.
absolutely pleasure, and I'm honored to be here. How's your mother doing?
She's okay. She had stage 2 back in 2008, and then in 2018 we found out it metastasized to 2 spots on her spine. And then within the past year or so, she developed some liver lesions that we've been keeping an eye on. A spot on her lung showed up in her recent PET scan, but she's been doing. I mean, she works with a naturopathic doctor based out of Colorado. My mom resides in New Jersey, but she's been doing like high dose IVC. She started doing some off label drugs. I mean, she's in New Jersey, so it's challenging with the therapies, as you know, that she can do on the East Coast. She recently started Verzenio, the CDK4/6, which we were trying to hold off on, but I think given the liver lesions, we're like, you know what, we could, consider introducing it. But she's feeling well. She's in good spirits, which is obviously most important. So,
Yeah,
yeah.
absolutely. Good. Well, I'm glad that she. Yeah, it's always a journey. It's that continual journey that you have to work
Yeah,
with. So
absolutely. But I
yeah.
tell her every day, I'm like, mom, mindset is everything. And I think if she has all the physical stuff nailed down, I think she really needs to focus more on the emotional healing component, which I know you speak, a lot to. But yeah, it's been a journey for sure. But
Yeah.
again, God brings good out of everything, and she's the reason why I started this platform and why I'm doing what I'm doing. So
Well, thank you for spreading information. We all need to kind of band together and spread good information out there.
yeah, absolutely. Well, Dr. Karlfeldt, you have quite the background, and I always love to start by just asking my interviewees if you could share a bit more about your background and your journey that led you into integrative medicine, because certainly everyone in this space always has a story, right? And I'd love to hear yours.
Well, I mean, I've been in clinical practice since '87, so it's been quite a while. I grew up in Sweden. I originally uh, originally studied to become an engineer, and
Yeah.
it was a gentleman that I met when I was like 10 years old at a bed and breakfast in Switzerland. And he later on became like a father figure to me. And he was a leading naturopathic doctor in Sweden. So while I was doing my studying to become an engineer, he he said, "Why don't you check out what I do? Working with people and supporting them through natural means." And I really fell in love with it, and I saw the impact that he had on his patients, and I was thinking that I wanted to become like a particle physicist and go to Stanford and study there, and But then I was thinking that, well, the human body is a pretty complex piece of machinery. And so if I wanted to solve something complex, I would say the human body would be it. And sitting in a lab counting particles, electrons, I kind of figured that'd probably be pretty lonely and boring after a while. Um, so I went into naturopathy in regards to, I, I mean, so I've seen pretty much anything and everything. I've hundreds of thousands of patients and interactions. So, but I fell in love with cancer, not because it started. So there's a number of reasons. It started with that, having patients that came battling cancer and just seeing how little support that they had and how few options that are available. And this was like in the 90s, so this was chemo and all of that was still in its infancy. It was still pretty crude. I mean, it's not that it's not crude now, but they kind of dialed in dosages a little bit better than they did then.
Mm.
Um, so I was just seeing that people are suffering and they were not given options, and that put me down that path of really trying to figure out what do we need to do. How can I help these people? And I had some really amazing successes even early on, with pancreatic cancer that was almost carried in, and then within a week he was up on the roof, fixing the
Wow.
roof. So I've had another one with pancreatic and liver, um, and he the cancer went away, and he lived. He was doing great. So had a number of these successes and realized that there's more that can be done. Adding layer to that, then my father, and I wasn't very close to my father, so I actually didn't know that he was battling cancer when he was. Nobody had reached out to me, and we weren't communicating much. He was a strong German, and um, I found out 6 months after he had passed that he
Wow.
passed from colon cancer, and he just went the regular standard of care route, just melting away, you know, just becoming bones and nothing, while getting chemo and surgery and all the normal things, like the death ritual in a way.
Was he in
And so
Germany
he
during
was
that?
in Sweden during that time. Yeah,
Okay.
yeah. So these are the reasons that I really, cancer has really become a passion of mine. That's why I wrote my book. That's why I have, podcasts like yourself. That's why, summits, you name it. But it's one of the areas that I really, really like to focus on, and so develop pretty intensive programs and for patients to come here.
Yeah, we certainly share the same passion. And I'm sure a big part of it is that, I mean, you yourself seeing patients every day, the fact that you can take patients with advanced cancers, right, and be able to essentially revive them and bring them back to a state of remission is incredible, because that's something that, again, like stage 4 cancer patients today don't necessarily hear from conventional oncologists, right? That there is no hope. You have this diagnosis. This is what you're going to die from, when again, it is possible for you to go into remission even at that late of a stage. It's just a matter of, again, which therapies do you opt to pursue, your mindset, everything that's mentioned in your incredible book that I was reading last night. But I'd love to cover, as I was sitting down last night, I was trying to figure out, which topics I want to focus on, right? But whenever I speak with naturopathic doctors such as yourself, I'm always interested to hear your thoughts on a broad array of topics. So we're going to be jumping around a bit. I hope that's all right with you. But
Take,
I would.
take me wherever you want me to, where you want to go.
Wonderful. Wonderful. Well, I would love to start. I know you leverage autonomic response testing when initially meeting with patients. Can you explain a bit more about what that is and why you find it helpful?
Well, so there's only so much you can find in the blood, and what's fascinating. So blood is kind of is trying to figure out what's going on in the houses by looking at what's happening on the street. And so it's not a full true true picture. So If you then instead start to kind of connect or tap into the wiring, the kind of electrical wiring between all the houses and all the communication that's taking place, all of a sudden you start to understand, what's really going on in the tissue. And autonomic response testing, or ART, is a way then to tap into our autonomic nervous system to see how it's responding to stressors. And you can introduce any kind of stressor, like a fungus or heavy metal or a chemical, or even a vial of cancer tissue, and seeing how the nervous system responds to that. Also, you can apply pressure on nerve endings that relate to the different organs, like whether liver or pancreas, and seeing how they handle that stress with just that applied force, where when you're applying that pressure, you're then decreasing the circulation to those nerve endings, and that puts a stress on them, that then signals the stress into the organ in itself. And you can monitor that simply just by pushing on an arm, seeing if it stays strong or goes weak in response to these different stressors that you introduce. So that way you can put stress on the electrical communication system in a way, and
Mm-hmm.
see if it is overburdened with any one of these factors. And if it is, then you know that that is an issue. And then you can then bring in remedies to see what can we bring in order to be able to support that stressor, so that it's not overwhelming to the body. So it just becomes a very elegant way to learn so much more about the body than what you can find in blood tests. Doesn't mean that blood test is not useful. It is a really powerful tool, but it's not the only tool. I think it's good to look at the body from several vantage points at the same time.
Yeah, that's so interesting. How does that differ, or perhaps maybe it doesn't differ too much from muscle testing?
So it is a form of muscle testing, and and there are a lot of different forms out there. The reason I like this, and this is a form that was developed by, or formulated, I should say, by Dr. Dietrich Klinghardt. He's a leading integrative doctor, and so it just kind of eliminates a lot of caveats that, because there's no testing technique that is perfect. And
Mm-hmm.
so to find one that has the least amount of caveats is of great benefit. And from my personal experience, I feel that this is the one. Obviously, there are a lot of other practitioners that will argue against, argue for whatever technique they use, and say this is why we're using it. And I'm not going to argue against them. I just say that this is the one that I like, and this
Yep.
is the one that worked for me.
Yeah. Very interesting. Have you heard of acupuncture meridian testing?
Yes, yes. So I used to do that quite a bit, actually, where you can then check and see the different meridians, and then you see there's certain meridians that you want to balance, and you want to have it balanced from left side, right side, and that's amazing as well, to really see what's going on in the body. So there are a lot of cool testing techniques out there where you can really learn about the body. I mean, like, we have something that's called AO scan that measures and the frequency in the bone, and
Wow.
each tissue has a certain frequency, and it vibrates at certain level. If it is healthy, each pathogen, each chemical, all of these things have different frequencies. So as you kind of measure these frequencies through the bone, you can really test and see where how healthy the tissue is, what kind of pathogens are there. So there are a lot of cool devices out there now that's amazing to support us understand the body much more.
Yeah, it's so interesting. And one thing I had heard in one of your podcast conversations, that you use the insights from ART testing to essentially help inform the order by which, you treat a patient with different modalities, which I think is really interesting, because I've heard from a lot of the functional doctors I've spoken with is that, especially with stage 4 cancers, you want to attack it at every different point, right? So let's just throw 5, 6 therapies at a time, pulse therapies. But when you mentioned, no, there's actually a proper order based on the individual to do the therapies, that was incredibly insightful and eye-opening and interesting to me. So can you touch on that?
Yeah, so I mean, the body health is like a safe in a way, and you can't just use all codes at the same time and think that the safe is going to open. So you want to first do this code, so this type of therapy, and then do the next therapy. Whenever the body is ready, you want to kind of listen to the body to see what is the priority, what is it ready for. Because even something as amazing as vitamin C may not be the appropriate thing for an individual.
Mm.
Or eating avocados, which is very healthy, may not be the perfect food for a person. Or even though a person knows that it has parasites, uh, the body may not be ready to deal with getting rid of the parasites. Maybe we
Hmm.
need to open up the detox pathways. Maybe we need to support the endocrine system. Maybe so all of these maybes are what we want to allow then the individual's body to communicate to me, so that we have a relationship rather than just me doing therapy onto somebody, but that there's a communication back and forth, and that communication that becomes really valuable in order to be able to guide an individual towards health. Even if they're dealing with stage 4 cancer, you want to still see what can the body handle. Can we do a lot of oxidative therapies, or do we need to nourish that body right now, or do we need to reduce inflammation? What do we need to do?
Yeah.
And ART just becomes a really powerful tool in that journey.
Outside of ART, are there any specific blood panels you look at? So I know like Dr. Nisha Winters looks at what she coined as a trifecta. There's certainly so many other ones outside of what conventional oncologists test. Are there any favorites of yours that you use on a daily basis?
Yeah, and I follow Dr. Nasha's work quite a bit, and she's amazing with the metabolic approach, cancer. So I do the same. I also look at LDH, SED rate, C-reactive protein, and then also a lot of the other ones that are really important, like fibrinogen, ferritin, homocysteine level, and you want to obviously make sure that the blood sugar regulation is appropriate. Uh, and then you can check for like VEGF and there are a lot of cancer drivers, IGF-1, that are important to look at, and also like TSH, for instance. A lot of people don't realize that it is a stimulating hormone in itself, to stimulate
Mm-hmm.
growth. So you want to keep that one at a fairly low level. So if you're very hypothyroid, then you want to make sure that you support the thyroid to keep that TSH low. Obviously you don't want to keep it so low so you can't sleep or be anxious or heart racing, but you want to keep it at a lower level. And I usually like to keep it at least below 2.
Mm-hmm.
That's my if I had my druthers.
Interesting. All right. I told you we're going to be discussing a broad array of topics. So, next on my list, I love your thoughts. And this is a very nuanced area, right? So, biopsies. I came across an interesting stat that between 20 to 42% of breast biopsies actually reveal a breast cancer diagnosis. So, keeping that in mind, let's say a patient has gone through screening and something's been identified. First, is a biopsy ever really necessary? And at what point would you recommend that person go through with one while taking into account the risks associated with that procedure, right? Like the risk for tumor seeding that we so frequently hear.
Yeah, and there's a lot of things that I what I want to do is for the patient is to kind of give them the understanding of um, what the risks are. So I tell patients all the time is that whether they ask, should I do chemo, should I do radiation, should I do biopsy, should I do surgery, and I tell them that I think I know what I would do if my wife had cancer, if I myself had cancer.
Mm-hmm.
But it's amazing how what we think we would do changes
Mm-hmm.
when you actually are dealing with the cancer. So I can say things, but at the end of the day, it is the individual's choice, and exactly what I would do at that moment, I wouldn't know until I was in that moment. So uh, and I've yeah. So in regards to biopsy, there are a lot of risks. Obviously, one, exactly what you're saying. You have cancer is kind of like an encapsulated area where the body is gathering all the garbage and all the everything that it doesn't want floating around in the body. So it just kind of have it in a protective area, and it's not really the tumor in itself that kills people. It's when it metastasizes and goes other places. So whatever we can do, obviously, to minimize it going to other places is we would want to do that. And so here we're doing then the biopsy, which we are then kind of poking, that protected area. And yes, there are risks, exactly what you're saying, needle seeding, and then also that there's a risk then of spreading because you're kind of opening that door, that pathway. So when is it beneficial then to do biopsy? Well, it is in reality, if you're choosing to do like chemo or choosing to do these other type of therapies, then it is important. I mean, for the oncologist, whether you're dealing with breast cancer, is it triple negative? Is it
Mm-hmm.
HER2 positive? Is it so that determines a lot in regards to what kind of care that they will offer. From a naturopathic point of view, it's somewhat helpful, but it is it. I mean, to me, it's not worth the risk. If you're not choosing to do the traditional oncology pathway, because you still want to go the same direction. You want to look at what are the root causes, and you want to address that, and you do want to then see what uh, you want to use in different therapies that boost the immune system, that support the metabolic pathways, that controls inflammation. And then with the root causes, I mean, I use ART, but I also use lab testing as well, to check them for mold, for heavy metals, chemicals, for other pathogens, and see, what's going on there. And then, going down the pathway of traumas, belief systems, and looking, see, are there factors there as well that you really want to look at. So those are pathways we would walk down anyway,
Mm-hmm.
without the biopsy. And so, but again, it is the individual's choice.
Yeah. I'd be very curious, and I don't know if there's existing research on this, but women who have very low grade, like stage zero, stage one cancers, breast cancers, right? I'm just curious, those who opt to go through with a biopsy and have it surgically removed versus those who choose to do nothing, what is the overall survival difference, right? Because we hear of people living well into their 80s, 90s with active tumors in their body, but it's just a matter of, the tumors, they're not growing, right? They're just there. So it's always that question, right? If we've identified one small grade tumor, is it really worth, and surgery too can pose risks of tumor seeding, as we well know. So it's just, in hindsight's 2020, but that's a question that I ask myself too with my mom's case. I mean, given, as I had mentioned, she had stage 2, but if we never even touch that tumor, like what state would she be in now? So has there been any research on that?
I'm sure there has been, actually. I don't know of it, and I'm actually really curious myself. Um, and I know that, I mean, the challenge is that, when, and the question was in regards to this, not breast cancers, but like PSA, measuring PSA.
Mm-hmm.
And it's a kind of similar scenario that with the PSA then being elevated, are we responding more aggressively than we need to? And because of that aggressive intervention, are we then creating more problems than if we would have done nothing and not measured? And
Mm-hmm.
it seems that that is the case. By not measuring, then we are actually creating less problem. But then you have that one person that, let's say they did not measure, and then lo and behold, he has stage 4 prostate cancer. And then he says, well, I would have wanted to know ahead of time.
Yeah,
So it is hard. It's hard to know. It's the
I'm
same
sure.
same scenario. Percentage wise, I'm betting that if we did nothing, that we would be in a better place.
Yeah.
But it is always then that one individual, let's say that they're, 1 out of 10 that did not do better, then that is the one that is going to drive that I would have wanted to know.
Right. Yeah. Catch 22. And let's say for those who choose to, go through with having a biopsy or even surgery, what are some ways, natural ways, that we can mitigate the risk for tumor seeding? So I've read a decent amount on modified citrus pectin, which my mom began taking not too long ago. But are there any other things that you could recommend for patients?
Yeah, so the key is that you have certain things that patrol, the body to mitigate that cancer cells are not able to go where they need to go. So modified citrus pectin is a great one. It works kind of like a Velcro on the cancer cells that it's a harder time to attach. Other things that you do want to do is obviously you want to support your immune system. Immune system is a big aspect in regards to what's going on and controlling cancer throughout the body. You do also want to be on pancreatic enzymes. That's another
Mm,
one that is circulating to control. That's kind of like the police force in the body. And third thing you want to make sure is that you support then your inflammation. And I mean, these are things that I'm bringing up in the book, as you know. But inflammation is a big factor. And inflammation can be caused by stress, how we're thinking, what we're eating, what we're exposed to. So we need to consider these factors in regards to controlling stress, because stress in itself is inflammatory. And then obviously, are we eating a diet that is non-inflammatory? So when we are then exposed to, when we're doing surgery or biopsy, then you want to consider that as well. And then you want to make sure that your detox pathways are open. So when regular, like the pancreatic cells, immune cells are killing cancer cells, there's debris, and we want to make sure that that debris doesn't get reformed into some cancer later on. So we want to be able to eliminate that. And then we want to keep the healthy cells as strong as possible so that they are not being converted easily to become cancer cells. And then you look at the mitochondria, how are the tissues hypoxic? Are they producing the energy that they need? So then we want to make sure that that is addressed. So there's all these factors that are really important to consider, anytime that you do like surgery, biopsy, because that act in itself is very inflammatory. So anytime you go into the tissue, you do surgery in that tissue, that is going to trigger an inflammatory response. And if we don't control that and it becomes too much, and that will then fuel cancer activity, or if we do radiation to that tissue, that's also very inflammatory as well. So
yeah.
we're causing a cancer conducive environment by bringing in inflammatory measures, into that tissue. So it is important that you control all of that, through that process.
Yeah, absolutely. And Dr. Karlfeldt, so when I was in college, funny story, people ask, how did you find yourself in the health space? And I gave you a little synopsis when we first started. But I studied finance and economics in college. But perhaps I guess my most proud accomplishment was the writing of this thesis that essentially advocated for an integrative approach in our healthcare system. And I had a whole chapter just dedicated to the topic of inflammation and how it fuels cancer. And just again, like the complex pathways, things that were way over my head that I just had to research and actually see, the relationship between inflammation and cancer growth. It was incredibly fascinating. And it just goes to show you that being in a chronic state of inflammation really can lead to cancer, right? As you said, be that through emotional stress, lifestyle factors, nutrition. So it's really something that more folks need to pay attention to. And when you mentioned mitochondria, that sparked a question I had for you. As you know, I do a lot of research for my mom, and I came across something called fermented wheat germ. And within that study, it said that they had found that fermented wheat germ actually had the ability to revert a cancer cell's metabolism back to normal and essentially make it a normal, healthy cell again. Is there any truth to that? Is that possible?
Yeah, it was interesting actually at the summit that I just finished last year. Um, it One of the researchers, Mary Hardy, and she's also seeing cancer patients at big cancer centers, And there's huge amount of research, exactly what you're saying in regards to the fermented wheat germ extract and how that interferes with how cancer cells gain energy. Because we look upon the mitochondria as mitochondria is the energy factory of the cell, and obviously cell does not function without energy. And so when a cell is under so much stress that it recognizes that it can't survive the way it's still functioning, it's then shifting into a survival mode, and that has to do with the signaling then from the mitochondria signaling then to the DNA, to increase actually oncogenes and suppress oncosuppressor genes. So this is kind of a hardwired survival mechanism that we consider is cancer. So with that, then the cell shifts to producing energy in a different way. Where it's, instead of using the mitochondria to produce energy using oxygen, it is then fermenting sugar, which is a anaerobic or without oxygen type of process. And so fermented wheat germ extract really helps in then blocking that pathway, how the cancer is then gaining energy, through the fermentation process. And so that puts in the cancer cell at a very strong disadvantage, obviously, because it is not able to produce the energy that it needs in order to function. And then also, it's not able to secrete the byproducts of that energy production, like lactates. And that's why we measure LDH quite a bit, to see what's going on in the body. Does it have enough oxygen, or is it in that fermentation state? Um, so that and that lactate is a signaling molecule that actually signals to the environment around that cancer cell to become like itself, and also to promote metastases and promote the uh, increase of creating blood vessels to feed that area. Because of this way of producing energy, the cancer cell is very actually inefficient in producing
Mm-hmm.
energy, so it needs a whole lot more resources. That's why it needs so much more blood supply, but it also leaves it vulnerable if you shut down that process. And that is what substances like fermented wheat germ extract really helps, that I use quite frequently in my practice.
Yeah, so interesting. I know I had my mom start on it a while back. It's funny because I feel like she'll start something and then I'll have her stop it and start something else, because I've also been doing a lot more reading on the concept of pulsing, right? Especially when it comes to like a ketogenic diet. And you don't necessarily want to give the cancer cells a chance to adapt to whatever modality or therapy you're essentially targeting it for. So, do you often pulse therapies in your clinic with patients?
And that's where kind of the beauty of like ART comes in, where you're then able to then test and see if the body's ready to shift in certain areas. And you're absolutely right. The cancer is very, very intelligent, very smart, and it is kind of a earlier programming that we look at it, and which means that it was designed to survive in a very hostile environment, and to be able to could function and exist even in that type of scenario. So even though we create a very hostile environment, like chemo, like radiation, or if we go after it with a number of natural agents to try to block this pathway, that pathway, etc. And I'm sure there are gazillion pathways that we have no clue that currently exist. So obviously, the best strategy that we can do is to try to starve it and block as many pathways as possible, and then at the same time, try to use some oxidative therapy, and or use some other way to try to go after it directly. So yeah, so it is important to be able to be flexible in the protocol that you're doing, recognizing that cancer cells are very smart. They're not dumb. It's not just like a little, you know, just a tumor tissue there that is just kind of hanging out there. It is, once it's there, the cancer is probably already tried to communicate and try to figure out how to exist elsewhere.
Yeah. And speaking of multiple pathways, so I had Jane McClellan back on the show a month or so ago. And for listeners, she wrote this book called How to Starve Cancer, essentially curing herself of stage 4 cancer using a cocktail of drugs. So, again, different approaches work for different people. What are your thoughts on using off label drugs for cancer? Because certainly, like, they can target different pathways, right, to help kill cancer cells. But also, too, they have a big effect on the body's terrain, certainly your microbiome health, which is, the source of where most of your immune system lies. So, what are your thoughts on that approach?
Yeah, and I love Jane, and I love, know her very well. And I think repurposed drugs and what she's done, what she's brought out has been tremendous. And it has helped a huge amount of people to move through this journey more efficiently. So, I mean, it's amazing what she's brought to the world. And it is always that balance, again, if obviously any drug has an effect, any drug. I mean, if you can't kill a rat with a substance, then you can't really allow it to come out as a drug onto the market. So
Mm-hmm.
so every pharmaceutical will have some kind of effect. What we're seeing though is that when we're dealing with cancer, then you kind of weigh the pros and the cons. And a lot of these repurposed drugs have been around for a long time. Their safety profile is very, very high. Like metformin is a common one
Mm-hmm.
that we use. And so the benefits at that time then tend to really outweigh the risks, so to say. Like people are nervous about statins. That's another
Yep.
one of the repurposed drugs. And it seems like when you bring that in, you're able then to control that. You look upon cancer, especially metastatic. It's almost like a wildfire. So it is nice to try to kind of fix the house, so to say, but if it's on fire, you want to quench a fire,
Yeah.
and then you can start to repair and rebuild. And so then, things like the repurposed drugs are really beneficial in shutting down how that fire gains energy, so that we can quench it, and then we can kind of repair and take care of the adverse reactions if there are any from some of these pharmaceuticals.
Yeah. Is there a way to determine which drugs would be beneficial for a specific patient? So my mom has tried metformin. She's pulsed doxycycline around high dose IVC treatments. She's considering doing low dose naltrexone. I've been having, or rather encouraging her to look into fenbendazole. Joe Tippin's protocol, certainly there's a lot around antiparasitic drugs like ivermectin. How do we know which one to use?
And yeah, that is always one challenge. So one way is to look and see what are the common pathways that relates to the type of tumor you're dealing with. um, and that's kind of a general direction you can go. But knowing that cancers, once you block one pathway, and then another one can open up. And also then in regards to um, one breast cancer or one ovarian cancer may present itself different than another breast cancer, another ovarian cancer. So they all exhibit different type of pathways. So what Jane has really kind of pushed forward is that it is good then to block multiple pathways at the same time and try to cover as much as you can from the get-go, rather than to pick that one versus that one. And that's where she developed her metro map, that really make sure that you block some of the, like the five main pathways, or four main pathways that the cancer gets energy. One is then the fatty acids, FAO
Yeah.
pathway. You have the glucose, you have the glutamine pathway. And so making sure that you block these pathways as efficiently as possible.
Yeah. What are your thoughts on CDK4/6 inhibitors?
I'm sorry?
What are your thoughts on CDK4/6 inhibitors? Is that something that you use in certain situations in your practice?
Yes. So, I mean, I try to use more, again, for that, I use more of the natural ones, like curcumin is a powerful one. And so I try. So, with talking about the repurposed drugs, there are a lot of repurposed drugs that you can bring in, but also there are a lot of natural agents that block a different lot of pathways as well. So like the CDK4/6, it's the same thing. You can then I would move more towards some of the natural, like curcumin, boswellia, ginger. That is fantastic, and working on that pathway.
Interesting. This next question is a bit of a loaded question, and I understand certainly you provide a very personalized approach to your patients. But overall, Dr. Karlfeldt, which treatments have you found to be most effective across the board in terms of treating someone with advanced cancer?
Yeah, it is a loaded question because it's so different from different individuals, and I wish we have figured out, we solved the riddle of cancer. We truly have not. Nobody has. We've gained a huge amount of ground, and we've learned a lot. I would say, in the integrative space, the last 20 years have really exploded, I would say. So the therapy, I would say, if anyone's going to do one thing, I would highly recommend high dose vitamin C. That would be like the first thing that I would do. Um, Secondly, if you combine that with like hyperbaric oxygen therapy, and then also obviously diet becomes huge. So you want to, if you're going to do a heroic treatment like the first one you're choosing, I would say then vitamin C, and then combine that with hyperbaric or oxygen type of therapy. um, for a foundation, and that's important for people to understand, is that you have, I mean, like at my center, you have a huge amount of different, what I consider heroic type of therapies, like vitamin C IV, I would say, it's a heroic type of therapy. But the foundation is always the same. You got to look at, what am I eating? Uh, what am I thinking? And how am I moving? So those are the three fundamentals you always got to address. So that, if you're going to do a therapy that works, that is the best place to start, and that's usually the least expensive. And then
Mhm.
you have the vitamin C, or I use something that I like a lot that I've seen great results with. It's called photodynamic therapy, and that is then utilizing then a light to trigger oxidation in the cancer cell. And we potentiate that light absorption into the cancer cells by using photosensitizers that we introduce intravenously, or we can also, if we have access to the tumors, easy access like a breast or a prostate or colorectal, and then we can then inject the photosensitizer in the local area to have an increased absorption than in the cancer cell. So when the cancer cell has that photosensitizer then inside of itself, and it's exposed to light, it will
Yeah.
then pull that intense energy at such a greater rate to cause an production of the oxidative substances, or trigger oxidation of the cancer cell to turn off the to kill it for apoptosis. So that's one of the therapies that I like quite a bit as well, and I've seen tremendous result. And then you have things like pancreatic enzymes, that the Kelly protocol, or Dr. Nick Gonzalez that did the Kelly protocol,
Mhm.
is also one of those that has had tremendous amount of success as well. And so I would say, and then there's another combination like poly-MVA, DCA,
Mhm.
is also another powerful tool that's out there. A lot of people have had great success. and vitamin B17. So there are a lot of amazing different protocols that's out there, and they've all had I've seen great successes. But again, it's not that one protocol is going to fix everybody.
Right.
And I wish that was the case. I wish we figured out exactly that, such and such person will do best on this program, and then it gets fixed.
Right.
There is some cool technology that's coming out where, with AI, where we are getting better, like your question in regards to the repurposed drug, or what are we going to use. There are some amazing technology that's coming out that I'm looking into, and so
Yeah.
it's advancing tremendously fast, and it's because there's a need.
Truly. I recently was reading about, I think it's pronounced histotripsy, which is essentially using sound waves to kill cancer cells. And I think it was recently FDA approved, but my understanding is that it's limited to patients with just like single or localized liver mets. But the hope is that it would one day treat cancer all over the body. So I've been keeping closely attuned to that information. But going back to the photodynamic therapy, this was one I was not too knowledgeable about prior to stumbling across your clinic and again the treatments you employ. But I find this super fascinating. And I guess my question to you is, for patients who can't necessarily go to a clinic like yours and do the whole process, could they still benefit from red light therapy?
They can, and what would be good is then to uh, you can buy like methylene blue. So what you want to do is that if you use a certain light form, then it's good then to use a photosensitizer that matches with that specific light. And
Mm-hmm.
like methylene blue will then match with red light, but also things very rich in chlorophyll, will also be a photosensitizer for red. So doing that in combination can be a really powerful way.
Interesting.
So you can even just kind of buy these little light bulbs that you would hatch, chicken eggs with. That can be a powerful tool. And maybe take methylene blue, or a lot of chlorophyll or chlorella or some spirulina or something that has a lot of the chlorella or chlorophyll in it, and do that like half an hour or so prior to, and then exposing you to the red light. And that can be a very powerful tool.
Interesting. Yeah, I got my mom a handheld red light therapy device, and I've been encouraging her just to hold it over her liver. But definitely going to consider introducing the methylene blue, because I have read some interesting things about that. I had another question for you. Oh, do you use mistletoe often in your
We
protocol?
we do, yeah. So we do it both IV at a high dose, and then also for sub Q.
Mm-hmm.
Um, it's not as effective oral. I know there are some oral products out there, but sub Q or IV is really, really powerful. And mistletoe is one of those intelligent agents. It modulates the immune system, so it increases the factors that need to be increased, and then suppress the factors that need to suppress. So and it's a really amazing tool, and it's fantastic to use if a person chooses chemo, because at
Mm-hmm.
that time, the immune system, white blood cell count will go down, and immune system will not be as effective as it needs to be, which is kind of an irony, because that is what you need then obviously to kill off the rest of the cancer cells. And
Right.
when you stop the chemo, then you have no immune system, and we know chemo is not killing all cancer cells. It's just killing the fast growing ones. So here you are, leaving all exposed after. So that's why it's so important to bring in, if you choose to do chemo, to do it in an integrative fashion, where you then bring in things like mistletoe, or vitamin C or ozone, or any of those therapies to then actually support the immune system to kill off what the chemo can't. And then
Right.
at the same time, and obviously protect the healthy cells at the same time.
Yeah, I couldn't agree more. It's the best form of natural immunotherapy without all the side effects, is how I essentially like to present it. And one thing I also did want to touch on, Dr. Karlfeldt, is nutrition. So you had mentioned circling back to, initial conversation, there's obviously a way to test patients to see what I guess they should be abiding by in terms of diet. What are some of those testing methodologies? And again, nuanced question, but overall, what is the best anti-cancer diet that you advocate for in your clinic?
So yeah, to each individual is obviously they're different. We're all unique, and our genetic makeup is different, and so that's why it's important to test and see how we process. How do we process meats? How do we process fats? How do we detoxify? How do we and there are genetic tests that you can use in order to be able to guide an individual to understand what's really going on. And as there's several of those tests out there. I mean, I have my preference, but it doesn't mean that what I like is always the best. It's just, again, what I use, and it works for me. So it is important to test an individual and see, how do they deal with food. I do like, so there are two directions that an individual can go that seems to have a very good effect. One going then nutritionally dense or plant-based, or doing more kind of a ketogenic type. So uh, and and I have patients go a little bit in both directions depending on what's going on.
Mm-hmm.
I do, as a whole, I tend to lean more towards a ketogenic, and for a number of reasons. But I have a lot of great friends that would argue, in the opposite, and that's the thing. They're even among us, that study this a lot. There's still, we still have our camps. That some people are in this camp, plant based only, and other
Mm-hmm.
people are in the ketogenic camp, or I tend to be less extreme as a whole. I do make sure that the person is on a very nutritionally dense type of food. And then if we need to go after the metabolism, which is if we are dealing with aggressive cancer, then we do. Then I would lean more towards a ketogenic type, just for that the reduction of the inflammation, and then also the glucose pathway is one of the biggest one, but doesn't mean it's the only one, but it is the biggest one. And you have a lot of people while you go through their cancer journey, obviously muscle mass and strength and all of that becomes an issue. And your immune system does require protein in order to be able to function appropriately. So I tend to lean more towards a ketogenic, but it needs, again, be a clean, healthy ketogenic. And it is good to measure at that time, while you're doing it, so that you truly know where your ketones are at and how you're responding with different foods, because we can all respond in different ways. Like I may respond to an avocado differently than you respond. And so if we have then measuring device like a Keto Mojo, as a
Yep.
common one, we will then directly know how foods respond, how we respond to them, and then control our ketone level and also our blood sugar.
Yeah. No, I couldn't agree more. I had Dr. Winters on the show again about a month or so ago, and I think the consensus from my conversation with her was that she's a big advocate of a metabolically flexible diet. And she's one that really strongly advocates for plant foods. And we had this whole conversation again how plant based does not mean vegetarian by any means, and how she essentially advocates for using meat as more of a condiment rather than having it consist of, 70 or more percent of your plate. And I am curious too. I mean, I'm sure based on the person's type of cancer, diet is obviously going to shift. So my understanding is that for breast cancer, fiber is so critically important in helping the body detox from excess estrogen. So in your breast cancer patients, I mean, is that something or an area where you again advocate for more cruciferous based vegetables?
I do, yeah. So you have, different substances are really powerful, and so you got to kind of look at food as your medicine, like what Dr. William Lee, has done a lot of research in regards to the anti-cancerous components within each food, and by bringing those in, you are then more able to battle cancer. And there's so many amazing nutraceuticals and phytochemicals that exist in all these different foods, and these are medicine. These are powerful tools. And like you mentioned, the cruciferous in regards to any kind of hormonal based cancer, like prostate or breast or ovarian, or but you also see that, like in a colon cancer, there are a lot of hormone receptors or estrogen receptors along the colon cancer. So even if it's not strictly a hormone based, it is still good then to support the removal of unwanted hormones. And cruciferous are really powerful in that area. Like you mentioned, the different names of them. So to bring them in can be a really important thing to do. Sometimes you also have, if you do high excess, then it can then interfere with the thyroid function. So you want to kind of keep an eye on that as well. And some of
Mm-hmm.
them are high in oxalic acid, so you want to keep an eye on that as well. So it is that kind of balance in
Balance.
regards to what you're eating, but you can then use food really as tools. Like sometimes if you need to support the sulfur pathways, and to bring in more onion and garlic, and but you will learn more about that actually when you do your nutrition genome. How
Mm-hmm.
you process sulfur, or how you process these other components, to learn more how what type of diet you should have.
Yeah, everyone's different, right? And again, that's why I'm such a fan of testing to see, what your body needs. Well, Dr. Karlfeldt, this has been such an insightful conversation. As I'm sure you can tell, I can talk to you for hours. I'd love to have you back on again at some point to perhaps discuss a more focused topic, but this was just wonderful for me. I really enjoyed this conversation. So thank you for your time.
Thank you so much. It's been wonderful. And yes, as I mentioned before, I mean, for everything we talked about, I mean, that's why I wrote a book, because there's so much information out there. And I felt it added to what a lot of the great books that are out there, like you mentioned, Dr. Nasha Winters, Dr. Jane McClellan, there, Dr. Paul Anderson, Dr. Neil
Mm-hmm.
McKinney. I mean, there's so many great individuals that are sharing, bringing information out there for everyone. And I feel that my book kind of fit along with that group, to really bring more understanding of what's going on.
Absolutely. And I will definitely include the link to that in the show notes. And also, where can listeners find you?
So they can, the best place is just to go to my website, the Karlfeldt Center. I'm sorry, the Karlfeldtcenter.com, or give us a call. We're at 208-338-8902. And we'll be happy to assist you with whatever questions that you have.
Wonderful. And I did have one last question for you, and that is, what does being well and strong mean to you?
Yeah, so the most people think about it as a lack of disease. That health is just lack of disease. Yeah, to me, well and strong is to be well beyond just being asymptomatic. It is having the vitality and the joy to just experience life to its fullest, and at the same time, then. Uh, Even when you are well, then to assess, to test and assess, so that because there can be a lot of things that are brewing that you don't understand and you don't know. And so I do, suggest that you frequently check for, where are my chemical levels, heavy metals, my pathogen levels, my nutritional level, my hormonal level, where are they, and then optimize them, so that you can continue to be well and strong, without having to worry then about cancer being in kind of in the background. And even though you feel, and that's the thing, the majority of cancer patients that come to me, they say, I feel great. I haven't been sick a day in my life. So you can't use that as a measurement. That you got to look elsewhere. And to me, monitoring and living life to its fullest, that's well and strong.
I love that. I couldn't agree more. Well, thank you for your time. And I'm looking forward to sharing this with listeners and having you back on again as well.
It'd be my pleasure. Thank you so much, Jacqueline.